Pemirsa, saat ini saya sedang berada di Health Summit 2025 dan akan berbincang bersama Ibu Esra Erkomai, President Director AstraZeneca Indonesia. Hello, Miss Esra. Greetings.
Thank you, terima kasih.
Thank you for joining us today. So, speaking about transformation, every global economy has its own unique vision. And what is AstraZeneca global vision and how it is being applied to bring added value to Indonesia healthcare ecosystem?
AstraZeneca is a science-led global biopharmaceutical company truly dedicated itself pushing the boundaries of science and delivering life-changing medicines that will transform the lives of patients but also societies and to the planet even. So throughout our journey in Indonesia, we have delivered more than 60 innovative medicines, ensuring that our medications, by evidence, delivering better outcomes for the patients in need than the conventional or the standard of care, to make sure that we make a truly difference in the lives of the patients in Indonesia. So that's what we do globally, also making sure that we deliver those medicines to Indonesia, register, but also make sure that it is accessible to the more and more patient groups, because these medicines are for anybody who is in need.
So resilience is actually the key, right? And healthcare isn't just about today, but also about the future. What is needed to ensure that Indonesian health resilience is sustainable?
One of the key pillars, again, I think very right, the Ministry of Health also prioritizing is healthcare awareness. Even from the youth, working together with Ministry of Education to make sure that while you're growing up, you make sure that you take the ownership of your own health, to make sure that you embrace healthier habits and be aware of it and take actions accordingly. That's very critical for the prevention of the diseases. I think the second pillar for the future, how we can ensure primary healthcare system is developed so diseases diagnosed earlier and then treated earlier, so that we contribute better to the people's lives. Because by evidence we know that the later the disease is diagnosed, it is difficult to treat and also cost is way bigger. So I think for the future of the country, what the government is putting in the practice in terms of prioritizing the screenings, making sure that increase the healthcare awareness, it will definitely contribute to the better and healthier future for Indonesia.
Ms. Esra, you mentioned about sustainability before, and to connect with AstraZeneca's role, what plans does AstraZeneca have through next year to continue strengthening the Indonesian health resilience?
So at AstraZeneca, we truly believe the connectivity of healthier people, healthier society, and also healthier planet. Because seeing the climate crisis is getting bigger and bigger. Changes in the climate has impact on the lives of the people, causing different diseases. So we are taking significant approaches through our zero carbon ambition, and together with our partnership with Ministry of Investment, we so far planted more than 11 million trees around Citarum River, contributed to the forestation programs. And not only that, we also trained and educated more than 70,000 farmers on how to do sustainable agriculture. Not only that, aligned with the preventive care and to the educating the youth, we are working hand in hand with our Young Health program to really engage more than 87,000 youth, how they can be trained and aware of their health care at their early ages, so that they can live so better. So another ambition we had also together with Global, we transformed whole our fleet to 100% electrical vehicles. It is the first in pharma. So all our I think initiatives is aligned with what is the government also prioritizing as a sustainable environment that we are also embracing as AstraZeneca.
Okay, so as the final point, you say that Indonesian health resilience should be sustainable. And what is Indonesian actually need to the sustainability is a long run term?
I think all the direction is there. All the, I think, vision is there. How we can work it much more collaboratively and in a faster way. I think that's the moving forward. How we can ensure we accelerate access to the medicine, make sure that our HCPs are developed, capable to diagnose the diseases earlier. Our systems are resilient, and how we can achieve it faster. It will also, will be very critical to make sure that we achieve our ambition together.
Okay, thank you so much, Miss Esra, for the collaborative and also inspiring perspective. Thank you. Demikian wawancara kami bersama Ibu Esra Erkomai, President Director of AstraZeneca Indonesia. Dari Jakarta, Diajeng Aulya dan juru kamera Hari Yoryantomo, CNBC Indonesia, Beyond Business.